It's time for The Verdict. The Verdict is a lively discussion of current events and legal issues pertinent to Oklahomans. The Verdict is hosted by Kent Meyers and Mick Cornett. The Verdict is brought to you in part by Betcher, Martin, Jean, and Jackson, when hurt people need help. Betcher, Martin, Jean, and Jackson in Ponca City. It's time for The Verdict.
And welcome once again to The Verdict, and good morning. I'm Mick Cornett, back from a short visit away from the Verdict set, but glad to be here. And of course, you know my co-host Kent Meyers, one of Oklahoma's top legal experts. Kent, good to see you.
It's good to see you. Congratulations to you officially, although I've done that a number of times since then. I didn't know whether we ought to change our music to Hail to the Chief instead of our normal Verdict music. We decided to keep it what it was. So glad you're back. We've got a really good show today. We're going to be talking about a somber subject, but nevertheless an important one, cancer. And Oklahoma's efforts to create an Oklahoma Comprehensive Cancer Center right here in Oklahoma City at the Health Sciences Center. One fact that I'd like our viewers to know about as we start the show, the national death rate on cancer is going down. In Oklahoma, it's the opposite trend. The death rate in Oklahoma for cancer deaths is going up. We've got a couple of guests that will be talking about that, as well as the development of the center. So why don't we get right to it?
Oklahoma's hopes for a comprehensive cancer center. That's the topic on today's edition of The Verdict. We'll be right back. Welcome back to The Verdict. Mick Cornett with Kent Meyers, who's going to introduce our guests.
We are very pleased today to welcome back to The Verdict for his third appearance, Dr. Joseph Ferretti. Dr. Ferretti is the Senior Vice President and Provost of the University of Oklahoma's Health Sciences Center. He's been affiliated with the Health Sciences Center since 1969. Unabashedly, I would call him an internationally recognized scientist in the field of infectious disease research. He is heads up the Oklahoma Health Sciences Center, which is one of only 4 comprehensive health sciences centers in the nation. He is active in numerous civic and professional activities. Dr. Ferretti, thanks for coming back to visit with us.
Well, it's really a pleasure to be here again with you, both you and Mick.
Thank you. To my left is Dr. Dewayne Andrews, the Executive Dean of the College of Medicine of the University of Oklahoma College of Medicine. He's a David Ross Boyd Professor of Medicine. He obtained his MD degree from the University of Oklahoma and is board certified in internal medicine. He's received likewise numerous professional awards from the medical community, and since 2002 has been the Dean of the Medical School. Dr. Andrews is making his first appearance, but we hope not his last appearance on The Verdict. Thanks, Dr. Andrews, for joining us.
My pleasure to join you here. Thank you.
Mick, start us off.
Dr. Andrews, let's first call up a graphic that shows the eastern part of the United States. And what our viewers will see, if they have a color set and their hue is set correctly, they'll see some red triangles, some yellow circles, blue squares, and green diamonds. But all of it's to show that there's a lot of these cancer centers in the eastern half of the United States.
Yes, nationwide there's over 30 of these cancer centers, and most of them are, as you say, in the east. There's 3 types of cancer centers that they'll see on that map. There's a cancer center which is focused narrowly on research in a certain area but doesn't really have a lot of clinical work. There's a clinical cancer center which does clinical care but doesn't have some of the aspects of the third type of center, which is called a comprehensive cancer center. That's what we're talking about for Oklahoma. That has clinical cancer care, research in the biology of cancer, research in the controls and prevention of cancer, the outreach into the community, networking with physicians and healthcare providers, thus the name comprehensive approach to the entire area of cancer.
As we switch to the western half of the United States, you'll see a scarcity of these same types of centers. How come?
Well, this, in fact, is one of the reasons we feel Oklahoma and this region needs a comprehensive cancer center. As you see, in the center of Oklahoma is a green diamond, which reflects our effort to begin working towards a comprehensive cancer center. The National Cancer Institute has joined with us in expressing their concern about this large region of the United States that is underserved in having these advanced cancer centers.
Well, Dr. Ferretti, let's move away from the graph now and talk about a comprehensive cancer center, which is what I understand we're striving to achieve here in Oklahoma. Who designates it as comprehensive, and what does it do?
The National Cancer Institute is part of the National Institutes of Health, and as such, it is one of the entities that provides support in terms of research and patient care and other areas to individual centers. Now, a comprehensive cancer center is designated by the National Cancer Institute, or NCI, and this designation gives some importance because there's a whole web of information that flows across the country, and we would be one of those centers. At the present time, we have what's called a planning grant, and that means that our center has been designated as one of the need areas in the country, and we have demonstrated to them by our own investment of people and priorities that a cancer center is and should be here in Oklahoma. So
now,
we have that grant right now.
But we're not starting from square one. We have the Cade Cancer Center. Just generally, what do we have now?
We have, actually, we have a lot not only at our center, but within the state of Oklahoma. And one of the really important aspects of a cancer research center, a comprehensive center, is that we provide new kinds of protocols that are not available anyplace else. For example, just this past year, we had a trial study here of Avastin, which was just approved for colon cancer. That's the name of a drug. It's the name of a drug, okay. And we were the only place in the United States that had that ability to provide that kind of therapy for people. We had 25 people enrolled. About 18 of them came from Oklahoma. The rest came from the rest of the United States and from Europe and Asia. So people will come to where there is a new protocol, and that's one of the kind of things that we want to have in the future, different kinds of new protocols.
What's the cost of this center going to be?
The cost of this center will be about $75 million. That's what we have, there's a bill in the legislature right now, but overall it'll cost about $178 million. We've already put up $40 million of that in terms of building a new cancer and genetics research laboratory, which is being constructed as we speak.
And where does the money come from specifically?
Well, the $75 million has been designated by the legislative leaders to come from a tobacco tax. And as many of you may know, that tobacco tax has just been passed on from the House, and it's going to go to a conference committee where people will decide. But the important thing is that this will be given eventually to the people of the state of Oklahoma to vote upon.
All right, Dr. Ferretti, let me jump in here and get us to a break. You're watching The Verdict. We're discussing a comprehensive cancer center right here in Oklahoma. We'll be right back.
Thank you.
Welcome back to The Verdict. Mick, Cornett, and Kent Meyers. We're with Dr. Ferretti, Dr. Andrews. We're discussing Oklahoma and a comprehensive cancer center that is least on the drawing board. And Dr. Andrews, you were explaining the $75 million in funding. What is the source of those?
Well, what we're proposing is that a bond issue be taken to fund this, and the $75 million would be derived from that. A small slice of tobacco tax, about $7 million a year for over 20 years, would help to pay that off. Now, in addition, we would propose $50 million of private and foundation donations. We have reason to believe we can do that. Longer term, it will be clinical care revenue and grants in cancer research that will go to the operation.
Dr. Ferretti, what's been done so far? Are we just just getting started, or has the work been going on for a while?
Oh, the work's been going on for a number of years.
Doing what?
And what we've done really is recruited top-notch researchers and physicians to our center. In the past 5 years, we've recruited 10 nationally and internationally known scientists and research and physicians to come to Oklahoma. And what they've done is brought infrastructure with them in terms of grants that are funded and new kinds of research. And of course, this is really important for the whole state of Oklahoma because it's an economic engine as well.
From a brick and mortar standpoint, has anything been done?
Well, right now we're having constructed a new biomedical research center building that's going to be specifically for cancer research and genetics. And that, we raised the funds for that for $39.5 million. So that's probably a year from now, that the doors from that building are going to open.
We start talking about the benefits of having a comprehensive cancer center. Dr. Andrews, I would assume the patients are one of the first user groups that comes to mind.
Oh yes, the patients and their families. We don't want to forget the families. Right now, when patients with cancer reach the end of routine standard community care of cancer, if they need more advanced forms of cancer, they're forced to go out of our state, the nearest being 450 miles away in Houston or beyond. What a comprehensive cancer would do for patients and their families is provide these kinds of facilities and services right here in Oklahoma, reducing the economic drain to our state, reducing the economic drain on those families, and particularly in terms of their personal comfort and ease, being in their own home state, not far away from their hometowns, to have this type of care, I think is very meaningful.
Well, Dr. Ferretti, the Health Sciences Center in general provides a tremendous amount of economic development to Oklahoma City and central Oklahoma in general. What will this specific cancer center provide that we don't already have at the Health Science Center?
Well, this cancer center will provide the newest and latest kinds of research. It's really important to know that our researchers and our scientists can develop a new protocol, and that protocol from the bench can be brought to the bedside of our patients. And that's one of the things that we're really interested in, is developing new protocols, new therapies, new diagnostics. And of course, that has sometimes an economic impact of spin-off companies and attracting other major pharmaceutical companies to Oklahoma.
Let's put this on a little more personal basis, Dr. Andrews. I mentioned in the opening segment that the death rate in Oklahoma is rising. Can you tell us a little bit about that?
Well, every month in Oklahoma, 618 people die of cancer. Over 7,000 new cancer deaths this year. And we have a diagnosis of cancer in this state every hour, it seems. So the cancer death rate is a little higher in Oklahoma. It's not rapidly rising, but it is rising, and we want to address that. And we want to address specifically, too, the special problems of children's cancer. And one of the important aspects of this comprehensive cancer center will be a major development in the area of children's health care and cancer, which I think all of us are concerned about.
Dr. Andrews, slightly off topic. What about a cure for cancer? How close is science to where we could see the end?
I wish I could tell you, but there is enormous research, enormous advances. We're getting closer. Will it come within the next 10 years? I doubt it. But the ability to regulate cancer through genetics research, and maybe we can't cure it, but we can regulate it better. Ultimately, yes, I think we'll get a cure. But that's a hard prediction to make, Mick.
Well, Dr. Ferretti, you just mentioned, I want to go back to it just a minute, that new drug, Avastin. That will have a potentially a beneficial effect on one form of cancer.
Yes, it's being used for colon cancer, and it's been approved, as I said, nationally. So other centers will be able to have this drug, but we were the first ones to have it. And so that was really important for our own development here in Oklahoma as a cancer center.
Let me ask you, let's take the remaining time here to kind of get your views about where you think we'll be, and insofar as the Comprehensive Cancer Center is concerned here at the Health Sciences Center in the next year, next 5 years, next 10 years. What do you see? And then I'll ask you the same question.
All right.
Well, of course, this depends upon what's going to happen in the legislature, and if this is approved by the legislature, it'll go to a vote of the people of Oklahoma. Now, there are several polls out that indicate that people would support this by a 70 to 75% margin, and people understand that smoking and other tobacco-related, other tobacco tobacco causes other tobacco-related illnesses. And so this is really important, I think, for the state of Oklahoma to go forward. And if they do approve it, we should begin construction of something maybe in a year and a half.
Dr. Andrews, what's your take on this from a patient care standpoint or a training of med student standpoint?
Well, I think that if we get this, it'll be a tremendous boon. We could, if all things go well, open this type of cancer center by 2007. We have other programs going now. We can develop this. This is the coming together of a unique intersection with opportunity and the availability of funds that we may not see again and we can't miss. We need to train more oncologists to take care of cancer. We need to train more radiation oncologists to take care of cancer. There is a growing shortage in this nation. We are an educational institution and a research institution, and this is where that's done. It's so important to Oklahoma, and I know we can do this if the people will give us a chance.
Dr. Ferretti, we got about a minute left. I'd like to use that opportunity for you to explain the impact of the Health Sciences Center on Oklahoma City and Central Oklahoma. The number of doctors that are there, the number of employees in the center. Go ahead and wow us with some details.
Well, the whole health center is made up of about 30 different agencies, and combined there are about 12,000 people there, and the economic impact of that center on our community and our state is estimated to be $1.7 billion per year. Now, just in the area of research alone, our institution brings in over $100 million a year, 41 of that coming from the National Institutes of Health. And although we don't get as much money as we'd like, having a cancer center is certainly going to improve that ability to bring in more funds to the state of Oklahoma.
Dr. Ferretti, Dr. Andrews, thank you both for coming on The Verdict.
Yeah, thanks.
Pleasure.
Kent and I'll be back with a final word after this. Welcome back to The Verdict. Mick Cornett, Kent Meyers here to wrap it up.
Interesting show. Joe Ferretti and Dr. Andrews are very knowledgeable. Of course, the two lead people at the Health Sciences Center. Those cancer death statistics are quite startling, and the diagnosis quite startling. We hope there'll be a much greater disparity 5 years from now between the diagnosis and the death statistics, and with a comprehensive cancer center that's likely to bring it about. Well, let me change the subject and go back to a show that I'm sorry you missed but was quite good, and that was the tort reform hour-long special debate. I want to report to you, as I promised we would, on how the straw poll came out. I want you to first see the vote.
This was on our website.
This was on our website. Excuse me. Do you favor passage into law of tort reform as outlined in this week's program? 64% of you voted yes, 36% voted no. We had a third question about modified tort reform, which only drew a nominal vote, not enough to even rank a percentage. And by the way, we had just about 5,000 voters in about 2-day periods. Quite good. Let's look at some comments now. What you said, you the viewers said in part on the yes comments, tort reform will help keep health care costs down. I strongly favor some controls on jury awards. If we don't have some kind of tort reform, we're going to lose access to health care and hospitals, particularly in the rural areas. This can't be good for the citizenry. And then finally, I predict both the Senate and the House will pass tort reform so the Democrats, can say they voted for it, then it will die in committee. A little cynical comment there. On the no side, tort reform does nothing but take rights away from the people. Why is it that a jury of 12 people can decide whether a person lives or dies, but those same 12 people cannot determine how much an injury is worth? The propaganda is not true. Get your facts straight. It's very dangerous policy to try and legislate based on anecdotes, not facts. The courts are the only place where a poor person can be treated equally with a rich person or a big corporation. Just a few of actually, Mick, 8 pages of comments that we got from our viewers quite a great response, and we really do appreciate it. It helps us a lot to know what you think about it, but we like to give you that feedback.
Well, it's an interesting legislative session in general. I mean, there are some really large issues, and all of it is, in a way, is leading up to the November election cycle, which, you know, this could be, 2004 could be the biggest election year in the history of the state when you consider all the things that are up.
By the way, that's entirely true. By the way, I was, and you and Jim Talbert and the other candidates are to be congratulated in the mayor's race in getting such a huge turnout in the mayor's race, where the only thing on the ballot was the mayor's question. How do you account for that, even in bad weather?
Well, I know our campaign worked hard at get out the vote, but you know, I think it shows that there's a lot of people, and maybe they aren't, you know, plugged into every civic issue, but they do care who their mayor is, and I think that's what we learned. And you know, it's a big city, and you know, that's another thing you learn. Oklahoma City goes into 5 counties. It's a lot larger than, you know, just the central core district, and there's people all over the city that wanted to check in.
Well, once again, congratulations to you, but I'm most pleased to have you back, being able to take over this show again as you do so well as our quarterback, and I'm really pleased that you're back and wish you good luck.
Well, and I tend to be here on The Verdict whenever time allows, but when I'm not here, I know you're doing a great job without me. Thanks to you also for joining us here on The Verdict. For Kent Meyers, I'm Mick Cornett, and we will see you next time right here on The Verdict.